Okay, so this is a quick demo of the new patient form using the Clear.Dental web front end. I'm using the Zen Family Dental website as an example, and let's get started. So on the actual Zen Family Dental website, there's a link for becoming a new patient. You click on that, and it gives you a number of choices: English, Portuguese, and Espanol. So for Portuguese, it'll actually show all the questions in Portuguese. Same thing in Spanish. And let's actually do, for this example, English. So it'll have the introduction and then if you're in pain or not. So if you're in pain, it asks a certain set of questions. Like, how long ago did you get the pain? Where do you feel it the most? Do you want this tooth to be saved? And how soon you can come in? The basic idea behind this is to essentially know ahead of time what the patient is looking to get done. Are they looking to get a root canal done? Are they looking to get an extraction? Sometimes they may be saying like, I want to get a wisdom tooth out. And if you already know that you don't do wisdom teeth, then you know how to refer the patient. So essentially, it allows you to have a patient come in without any surprises. Going back, it's expired because we've selected one particular type, pain or no pain already, so that's why it's asking us to try again. So you can resend this. And now we're going to do no, I am not in any pain. So these are simple screening questions so you know what the patient's chief complaint is. Like, do they have any chief complaint at all? They don't like how their teeth looked. You know what kind of x-rays to take, how long this appointment is going to be. So if it's a 23-year-old without any issues, you know it's going to be a fairly quick exam. But if it's going to be a 60-year-old with many broken teeth, or they really want to talk to you about implants, you know you want to get a longer exam comparatively, maybe an hour or so. Same thing for what you want to get done. They could just say exam and cleaning. Any past issues? So a lot of patients do say that they are scared of the dentist. And this is very important in terms of insurance wise. So you don't want to schedule a patient when they're not due for a cleaning, or if they're not due for a cleaning, they just want to get a consult. You know, you don't want to schedule both a cleaning and a consult on the same day. But if it's been a long amount of time, you may want to schedule for both. This is just so if we have to do any research in terms of, okay, when was their last scale and root planing? If they do have periodontitis, insurance-wise, are we going to be in any kind of trouble? Most people actually say no, or I don't even know what you're talking about. Just simple OHI questions. This is to help screen if there is any possibility of grinding. Um, and then history of braces. So you know that if you are going to do Invisalign, you already know that they've had orthodontic treatment before. And troubling at night, this is actually for helping screen for sleep apnea. Then the basic questions. Other. So this is actually supporting of any kind of trans, something like that. Or you can just leave it blank. January. This is important for nonprofit organizations that needs to actually record the race of ethnicities of all their new patients. This is great in terms of being able to say, Yes, I heard about you on Google Maps, or did I hear about you on Yelp? This does get recorded in a way that you can do statistical analysis of what advertising you're doing and how many patients you're getting out of it. So I'm just going to say from a friend. Uh, okay. So this supports the ability to contact patients regardless of what their preferences are. So some have a phone number and a cell phone, some have only a cell phone. You know that then how to contact you. They want to get a phone call or should you be texting them? You know that ahead of time. So a lot of people actually just use the same one for home and cell. Doesn't really matter. There's also a way for you to contact them via WhatsApp. That's often very useful, especially for people who are born and raised in South America, who primarily use WhatsApp for all communication. And then when it comes to scheduling the patient, you already know ahead of time, okay, this patient can only come on Wednesdays and Thursdays. That's it. And then they prefer to come in late afternoons. So you know what days to look for when you call up the patient. And then if they do have a dental plan, you can get all of their information ahead of time. And a lot of times they just fill it out halfway, but it does help at least getting a starting point if they say they're from they have Delta Dental or if they have Blue Cross Blue Shield, rather than just guessing out of the blue. And this is just to help out. Certain patients need to take antibiotics before any kind of dental treatment. So, unfortunately, a lot of patients still expect the dentist to prescribe the antibiotics. So it's good to know ahead of time before they come in if that is the case for the patient. Um, and then it could be any option like heart, joint replacement. I don't know. The doctor just told me to take it. Uh, Also, history of cancer. This is actually fairly useful if you want to know if they had any kind of head or neck radiation ahead of time. And then all the medical history. So this is more or less a review of systems like you normally see doctors do. So do you have any heart or blood disorders? You could say yes. It has all of the listed ones, or you could just say other. So I could just say heart murmurs. But if you say no, it goes straight to the next system. So that way it doesn't take too long for a patient to go through basically every disease, but it also is fast for patients who don't have that much going on in their medical history. And then get the list of medications so you know ahead of time if they are taking something like Coumadin. You know what type of things to expect for, especially if you're doing an extraction. And then allergies, you can say it's severe or I don't know. So very often patients would use this text form to say, hey, I have things I don't want to talk about. Like, for example, I want to talk about, okay. And then the simple consent form, they can use the mouse, so of course they can use their finger if they're on a tablet or phone. And then it shows up onto the new patient module on Clear.Dental. So that is the demo. Thank you for your time.